injury prevention, it's got to be better than treatment, surely. So how do we go about actually doing this? Well, we've got a bunch of methods here, in fact 5 of them, and I want to talk to you about screening first of all. Screening effectively is how we identify past and current injuries. Okay, so these tend to be sort of questionnaire based, getting to know your athlete's current to ours current injury. And of course, if you screen your athletes for their current physical health, that's going to inform you as to what you might need to do. You might do tests which identify muscle imbalances. Now, those of you that follow your football, this is one of the classic things that would happen in like a fitness kind of health check before someone signs for a football club, for example. We'd also establish that this is going to be something like assessing joint mobility. So these are literal measures of the body, right? And we are screening. Of course, if we find issues, that can lead us to believe that something might be about to go wrong, or has in the past, of course. We can also identify postural weaknesses. Okay, so if someone's got a postural issue, it's quite likely, or potential at least, that that's going to lead to some kind of injury. So again, if we can screen for that, we can perhaps prevent that kind of injury actually taking place. Now, just a couple of other points that I think are significant for us to address. Don't want to sort of go too far down here, but we also need to identify performers. So it might be that we identify performers at risk of complications. So what I mean by this is that if we've got someone who's a little bit fragile because they've had previous injuries, for example, or muscle imbalances, we can actually identify that that might become a problem and obviously try to prevent it or be prepared to deal with it once the issue arises. And finally, you can identify suitable rehabilitation. So of course, if you know what the problem is and what's causing it, a history of injury, for example, you can make sure that your rehabilitation methodology is the most suitable to get that person back to training and competing as quickly as possible. So screening, a super important part of our injury prevention sort of repertoire. Now, we also need to talk about PPE, or protective equipment. I'm going to give you just some examples to begin with, folks. Things like gum shields. I meant to do a different pink here, but you get the idea. Things like gum shields. Let me actually change it. I don't know why it's bothering me, but it sort of is. Things like gum shields are a really good example of protective equipment. What about any sport where you have helmets, caps? Think about your road cycling as an example. What about padding? We have padding in cricket, in American football. I'm going to call this personal padding. The fact that you wear it, you might wear padding around the shoulders in rugby union, for example. But there's also padding, which is more general. And this could be padding that is, for example, padding around a rugby post. So in case you run into it, it's not going to cause you any danger. We also experience what we might loosely call armour in certain sports. American football is a really good example of that. We might wear some kind of restrictive footwear. Think about basketball players who, for example, wear very, very strong ankle support trainers. And finally, we've got the notion of warm weather clothing, and it could have also be cold weather clothing. Okay, warm weather clothing. In other words, not freezing to death or suffering hypothermia. This is protective equipment that's going to cause this. Obviously, the example I just gave there was cold weather, but warm weather and cold weather, having the right equipment is going to do that. Now, everybody warms up, right? You do it before every session, and presumably you cool down afterwards as well. And we all know it's important, but why? First of all, reminders. It increases. It increases muscle pliability. If the muscle is more pliable, it's far less likely to get injured. There's our acute soft tissue injuries we're talking about there. We get a higher temperature, same output. We get better coordination of antagonistic pairs. Literally, we move more smoothly because we warm up. Therefore, we're less likely to suffer injuries. And generally, we get fewer soft tissue injuries, fewer acute soft tissue injuries. So of course a warm-up therefore is really valuable from that perspective. Now we're almost there. Flexibility training. Let's loosely refer to it as stretching. This causes up arrow an increase in muscle extensibility. If the muscle is more extensibility, of course when we come to participate, to compete, if we have to reach, we have to stretch, we're less likely to suffer injury, and this causes fewer tissue injuries. So that's soft tissue injury again, fewer tissue injuries as a result of flexibility training. So stretching, damn good for you. And finally, we're just going to finish off with taping and bracing. Let me see if I can choose the right colour. Taping and bracing here. I just want you to be aware that, in essence, what this does is it restricts joint movement. In the main, there are actually some exceptions to that, but in the main, it restricts joint movement. They might, for example, help, not completely, I mean, if you land hard enough, you're still going to do it, but they might help to prevent something like dislocation, a shoulder brace. And they also help us to return early after injury. So even if we haven't prevented the injury, taping and bracing can help us get back efficiently, quickly to what we like doing, which is training damn hard and becoming good athletes. Cheers.